Welcome to AfroNurse Academy, where we turn complex nursing courses into clear, simple lessons. This is the official breakdown of the NMC course curriculum. Whether you're preparing for licensure exams, facing semester tests, or just trying to understand what's ahead, knowing your roadmap is the first step to success. Quick tip before we start. If you're on a smartphone or tablet, flip to landscape mode. You'll see the course outlines, diagrams, and visuals much better that way. What you're about to see is the standard official curriculum approved by the Nursing and Midwifery Council. This is exactly what you need to master. Nothing extra, nothing missing. Now, looking at this outline, you might be thinking, that's a lot. And you're right. But here's where AfroNurse Academy is different. We're going to teach every single topic on this list, line by line, subject by subject. We'll break down each concept into simple, practical lectures that actually make sense. No confusing jargon, no information overload, just clear teaching that sticks. You don't have to figure this out alone. We've got you. So here's what you need to do right now. Hit that subscribe button, then tap the notification bell, because when we drop the next lecture in this series, you want to be the first to know. Grab your notebook, get comfortable, and let's master this course together. Your first real lecture starts now. Let's go.
All right, Anatomy and Physiology 2. If you've made it through A&P 1, you already know how this works. We're continuing our journey through the human body, and this time we're focusing on 4 more essential systems: urinary, integumentary, respiratory, and digestive. These are the systems that help your body eliminate waste, protect itself, breathe, and get the energy it needs to function. Let's start with the urinary system, because honestly, understanding how your kidneys work is absolutely critical in nursing. We're going to walk through each organ, the kidneys, ureters, bladder, and urethra, and what role each one plays. But the real magic happens in the kidneys. We'll break down how urine is actually formed, how your body filters out waste while keeping what it needs, and then we're diving into fluid and electrolyte balance, which is something you'll be monitoring constantly on the wards. Understanding pH balance isn't just academic, it's life or death in critical care situations.
Next is the integumentary system. Now, some students underestimate this one because they think it's just skin, right? Wrong. Your skin is your body's largest organ and your first line of defense. We'll cover its structure, all those layers and the appendages like hair, nails, and glands. But more importantly, we'll talk about how the skin regulates body temperature. Because when you're dealing with fever, hypothermia, or burns, this knowledge becomes absolutely vital. Then we move to the respiratory system. And if A&P 1 was about the heart pumping blood, this is about getting oxygen into that blood in the first place. We'll trace the pathway of air from your nose all the way down through the pharynx, larynx, trachea, bronchi, bronchioles, and into the lungs. You'll learn the structure of each part and why it matters. Then we're getting into the physiology, how gases are transported, how oxygen gets into your blood and carbon dioxide gets out, and the actual mechanics of breathing. When you're assessing a patient who's short of breath or managing someone on oxygen, this is the knowledge you'll be pulling from. Finally, the digestive system. And this is a journey in itself. We're starting at the mouth and traveling all the way through teeth, tongue, salivary glands, then down through the pharynx and esophagus into the stomach. From there, the small intestine, where most of the magic happens, then the large intestine, and we can't forget the accessory organs, the pancreas, liver, and biliary tract. Each part has a specific job, and we'll explain exactly what that is. But it's not enough to just know the parts. We need to understand digestion, how your body breaks down food, how nutrients are absorbed through the intestinal wall, and how those nutrients are actually used by your cells for energy, growth, and repair. Because when your patient has malnutrition, diarrhea, or liver disease, you need to understand what's going wrong and why. These 4 systems might seem unrelated at first, but they're all connected. The respiratory system brings in oxygen that the cardiovascular system delivers. The digestive system provides nutrients that every cell needs. The urinary system removes the waste that all this metabolism creates. And the skin protects it all while helping regulate temperature. It's all one beautiful, complex machine. And as nurses, we need to understand how every part works. We're going to take this step by step, make it clear, make it practical. And by the end, you'll have a solid understanding of how these systems keep your patients alive. Let's begin.